Managing marijuana. Medicinal use of pot's been legal in Rhode Island for a decade. So why doesn't the state test the drug for safety before patients use it?
And over in Massachusetts, where medical marijuana has been legal now for about 5 years, they do require testing. So Brian Yukono went to a lab to find out how the process works and if we'll see it in Rhode Island anytime soon.
From your medicine cabinet to your refrigerator, your pantry, everything we consume or apply has to be tested and approved for safety, but that's not always the case for marijuana. Tonight now, we are tracking the efforts to change that. We traveled to, of all places, 420 Fortune Boulevard in Milford, Massachusetts. This is home to Proverti Laboratories. Inside, CEO and founder Dorian Delorier give us a tour.
You can see the plasma field going now.
There are times this looks and sounds more like science fiction.
Supercritical CO2, so that's CO2 in its liquid form.
But this is one location where marijuana is tested in all forms, from the plant to oils and edibles.
So that could have been a flower, looked like a piece of flour, cannabis flour in there. It could have been a cookie or something like that, and it dissolves.
In Massachusetts, this type of testing is required. Bay State voters approved medical marijuana almost 5 years ago. The state then said 30 dispensaries would be allowed to open. Dorian Delorier bought all of this equipment, expecting a big return on investment. Progress is slow, however, with only 9 open today. Now he's focused on research and expansion to other states, like Rhode Island, which is currently drafting regulations for testing medical marijuana. He says this is about far more than potency.
The need for testing is real. The cannabis has grown a variety of conditions, from somebody's basement to professional grows, and all of those have situations where they could impart contaminants into the material. Nobody intends that, but it does happen, and the only way you can tell is by doing testing.
Delorier is talking about anything from heavy metals or pesticides drawn into the plant from the soil to mold or fungus. A safe product is his priority. Research and analysis also ensures that patients are treated with consistent dosages.
There are 2 reasons why you test, one for potency and one for safety. People have been making different extracts and products from cannabis, and it's not been tested. And so they're proficient at doing it, but you need to test to see where you're at.
Right now, there is work here in Rhode Island underway to create a new regulatory framework around medical marijuana, from tracking to testing. Coming up all new at 6, we're asking why that isn't already on the books when medical marijuana has already been legal here in the Ocean State for more than a decade. I'm Brian Yukono, Eyewitness News.
New details in a story you saw only on Eyewitness News: monitoring marijuana. At 5, we took you inside a Massachusetts lab that tests the drug for safety and is eager to expand into Rhode Island.
And new at 6, we're asking why the Ocean State doesn't already test medical marijuana. We've learned there is a plan in motion to build new standards for the testing, tracking, and sale of it.
Brian Yukono's here now with what he uncovered.
Medical marijuana was approved here in Rhode Island more than 10 years ago, but only now is there a plan in the works to make sure the drug's tested.
So we'll take you through the process.
This is one testing facility in Massachusetts that is eager to expand into Rhode Island.
So here's some fresh cuts from people that we're going to do some testing with.
In the Bay State, all marijuana must be tested, but it's a much different case in Rhode Island.
The medical marijuana program in Rhode Island has been virtually unregulated since it passed in 2006.
That's Norman Birnbaum, the principal economic and policy analyst with the Rhode Island Department of Business Regulation. He says that Rhode Island was one of the first states to legalize medical marijuana without much guidance from the federal government.
We didn't really know what we didn't know at the time.
Right now, though, the Department of Health is building a new framework of regulations to license testing facilities so that anything marijuana-based is properly tested, packaged, and labeled.
First off, these regulations are for public safety and for patient safety, so patients know that what they're using is consistent in terms of their dosage and what they're taking, and they're getting reliable results, but also that it's safe from contaminants, mold, mildew, any pesticides, things like that.
Birnbaum knows this will likely open business opportunities for testing companies like Proverti, that he cites as a job creator in other states. Another safeguard the state is looking to introduce is a seed-to-sale tracking system.
So it tracks it at all stages of production, and it will allow us to know that everything has been tested. It will allow us to know if something fails testing. We can also issue a recall if for some reason something fails tested.
There is also a focus to make sure Rhode Island stands above practices in other states.
One of the things that we really wanted to make sure was that the testing facilities were third-party independent testers, that people who are growing and selling weren't doing their own testing in-house, which some states do, which leads to conflicts of interest.
Birnbaum says those new regulations could be finalized within the next 2 months. They would then be reviewed at public hearings. He says then it's up to the businesses as to how quickly testing facilities can meet those standards to put a tested, approved product on the market. I'm Brian Yacono, Eyewitness News.